I've practiced medicine for 37 years. I told you that this is strange to me. Did I not say it?
You said so.
Yeah.
So, reports reached us of free medical outreach taking place in Benikrukru Community, where residents were said to be receiving comprehensive healthcare services at no cost. The program covers free medical consultations, medications, and even surgical procedures. Curious to ascertain the scale and impact of the initiative, we traveled from Warri to witness the exercise firsthand and gain a clearer understanding of the outreach that has drawn widespread attention across Bonamatu Kingdom. So we arrived safely at Benikrukru Community aboard our 200 horsepower outboard engine speedboat and proceeded directly to the Benikrukru Community Primary Healthcare Center, the venue of the free medical outreach. Upon arrival, we engaged the medical director and leader of the outreach team, who provided insight into the objectives, scope, and background of the program.
Right, I'm sure you know Matthew Tonlagha. The wife and him, they have a foundation they call Esther Matthew Tonlagha Foundation, and yearly they do what we are doing here now. Like here we are now is the primary health center. All right, and before now they have only one nurse that is there as a primary health center, only one nurse. But by virtue of Esther Matthew Tonlagha Foundation taking over the running of this place, they have given 2 doctors to this facility. So they do 2 weeks, alternate 2 weeks. Then they have 3 nurses that rotate every 2 weeks. Okay, they have employed lab technicians. Before now they don't have a lab technician. They've employed 2 lab technicians that run shift here. Some admin staff, receptionists. They have cleaners. Okay, so this place, they coming to the outreach. It's a yearly program, and I assure you know that Matthew Tonlagha and they were. All right, so since 22nd of December, we have been here as a medical team, and we resume work here on the 23rd, and we have been seeing patients. So every drug that we are giving out to a patient free of charge is sponsored by this foundation, EMT, Esther Matthew Tonlagha Foundation. And basically what we do here is patients come in, we register them. The card that we are using is sponsored by them, and we do some basic tests like sugar test. We do hepatitis screening for them. We do blood sugar check for them. But if they have symptoms of malaria, we have also equipment and reagent to do malaria tests. Okay. Now, having done that, they pass the case file to the doctor who see the patient, listen to the complaints of the patient, and make prescription. And we send to the pharmacy unit, and they give the patient drugs free of charge. You understand? And apart from that, we have come with a team of ophthalmologists. So what they do, they have about 6 of them that are in that team with a consultant ophthalmologist, and they treat major eye problems like cataract. They do operations, minor eye surgeries, they do it. They dispense glass freely to patients who deserve it, and they give eye drops and other eye care. That's what they are doing here. If you go inside now, I think you should go there and see them also. They are doing eye care for patients. So when we finish seeing patients here, we identify those that have eye issue, we send to them. And majorly, the rampant illness that we are seeing here is malaria, body pain, arthritis for some patients. But this foundation has done very well, because yesterday we saw a lady that has severe abdominal pain, and we the doctors think that it has acute appendix, and we say send to Warri because we cannot do appendix operation right now. And do you believe that they have a boat ambulance They used a boat ambulance. Within the next 1 hour, 1.5 hours, the patient was already in worry, and they are doing. They will possibly have done the surgery now this morning. So those are the things that they are doing, and we thank God for their life, because at the end of the day, I know how much they put in. As the head of the medical, I know how much they spent for this program to take place. Okay, and apart from here, and I'm sure you are aware that there is another center inside the Matthew Fathers compound. We call it Camp Clinic. We also equipped there, and patients in this community have freedom to go there and take free drugs. Okay, and maybe minor wounds dressing and all that. I call it minor surgical procedures. It's never been like this before, because like before, in a month, they won't see up to 20 patients. But now every day they see like 30 patients here. Every day. So what we are doing here is not new to them. If not for what we are doing, you will see here. The first time we did it here, we saw crowds, 1,000 something patients, because they are not used to going to hospitals. But now every day it's like they come here, so it's not new. What we are doing is not new to them, because only the high thing we are doing now that possibly they are capitalizing on. But if you saw this sickness every day, even on Sunday, they come here, they assess treatment. First of all, you see the renovation of the building. If you enter inside, you see that it's like a living home with POPs and all that, and all the doors are changed to plastic doors. It's done by the foundation. All right, you enter there, you see furnitures like the reception. You see furnitures. Then we provided a receptionist table. We provided a rack for pharmacy. Then we built the table for the lab, the bench for the lab, and lab equipment, microscope, centrifuges, and every equipment that is necessary to do kidney function test, liver function test, typhoid, malaria, cholesterol. We have all of them here. Typhoid test, wider test. We can do them here. We can do HIV here. All right. We can do sugar. We can do hepatitis. All those things are here. All right. Then the table for bench for delivery. We have delivery bench that they are using. Table, they call it table. Brand new one that they are using here. We have lights, standing theater lights that we bought in case somebody is doing minor surgery or you are doing delivery. Then angle poise lights that they use as if it's a big light you can use to point to when you are doing a pinpointed procedure. So we have it here. Then beds in the walls. You will see beds, fine beds, the one you see in teaching hospitals. It's here. They bought a lot of them. Then they have bedside tables, all right, that they put here. We have what is it called, ECG machines that they bought for this place, so they check the heart and all that. Okay, are you following? So now, apart from that, all those drip stands, then bedside locker, they have them here. Then tables for doctors to consult, chairs and all is here. Okay, so these are the basic things that can happen in a primary health center. They had only one nurse that was here, one nurse from the government. Every other arrangement is a guy that is paying them. He pays them, he pays the two doctors, he pays the two lab scientists, he pays the 4 nurses that come in monthly basis, he pays the receptionists, he pays the cleaners and all that. So, and he accommodates them in this community and gives them feeding money and pays them salary. This before, and you know it, that anybody who is sick, you have to rush the person to worry. Now it's not like that again. Doctors are in this community. So those are by and large what we are doing here. And the doctors, we have about 2 other doctors working with me here, Dr. Ben and Dr. Noel. They are there, so they are seeing patients with me. And we are seeing children, we are seeing adults. All right. And every drug that you think should be given in any health facility, we have it here. Usually, in government, this thing, challenges are bound. But here, no protocol, no bottleneck. You want drug. They say, in government, they say OS. And you write later, they will pass it to peers, they do this. 2 weeks, you have not gotten what you want. Here, 24 hours. As they just tell us, WhatsApp, if maximum 24, 48 hours. It's provided. And the equipments are there. So the only thing that revolves is the drugs. It will finish. The more it finishes, we are happy it's finished because it means people are taking it. You cannot buy drugs now. 1 year they've not bought another. If I tell you how much they spend buying drugs, you yourself you will shock. I don't think any person is doing such a thing in Nigeria, in Delta State, the way they are doing it. You can understand. I know what is happening. I've practiced medicine for more than 27 years. This kind of thing is strange to me. Where somebody pays doctor, pay for drugs, everything. Scholarship. I get my medical scholarship.